Look, having advocates beside you as you then go and speak with people who can give you legal advice, because they are very separate things, but under the same roof or in the same organisation or within this network of community legal law services and centres, is a really great opportunity for people to get what they need all in the one place. Not have to be shopping around, or now I have to go and call another place to get something else met. But having an advocate at the beginning can also be the strategy that reduces a need for legal support and advice, which is really where it escalates. That is about taking it to the next level. Whereas an advocate can help you much more with the carrot, and then the legal is the stick. But I think that the carrot is probably not even part of what we do. It's about just being there beside someone so they can have better conversations, so that they can look after themselves as they're taking on the challenges that they've faced, and take on the people who they feel have either wronged them, or the services that aren't providing the right access. Having someone there to take those notes, to provide some of that documentation, to give to those legal, the solicitors, to give to people who are going to provide legal advice, is extremely helpful, because that's the background information that may be needed to take those next steps. But having an advocate can also be the thing that de-escalates, makes everything much easier for the person to face, and doesn't need to go to that next level. Yeah, look, I guess the area of passion or interest that it's probably been evolving over my career is for people who have a hidden invisible disability condition. So they are the people who are living with mental health conditions, psychosocial disability, people with an acquired brain injury who fall through the gaps between the health system and the disability system, people who are stuck between the justice system, who should never be in the justice system, people who are dismissed and have low expectations put on them, probably since childhood, by people who may be really close to them, as not being able to achieve what the person beside them may be able to achieve. I think it's really important that we give space to people at all levels of where they thought they'd be in their life, because it can happen to any one of us at any time. And I think that's really important to remember. The person who is sleeping rough, the person who is currently in jail, the person who has just failed whatever test they've been put through, that could be any of us, or it could be our kids, it could be our parents. And I think knowing that that is something that is actually about the entire population, but it's so much more impactful at the disability level, because of access, because of a lack of modifications and accommodations in the environment, including in the digital environment. That means that people are constantly having to fight for those rights that everyone else is just taking for granted. So I think, it's really that hidden, the invisible disability, the people who don't know how to ask because they've never even explored or explained why they would need to ask for it in the first place. I'm a wheelchair user. It's really obvious, but everyone thinks that that's toilets and ramps. And to be honest, toilets and ramps aren't being done well anyway. So, that area hasn't been done brilliantly. However, it's not all about toilets and ramps. It is about accessible information, ensuring that people feel safe in their homes, that people understand where they go to for help if they're facing domestic violence and abuse, that they know how to advocate for themselves in their own families, even though mum and dad might have their best intentions. What mum and dad want for me is not the same thing that I want for me, which is why we know that's why we move out of home. We start to have separate ideas and different ideas, that those relationships should still be about family and about love and bonds and fun, having fun, not turning our family into our carers, into our support staff, into our advocates, having those individuals still in our lives as people who we want to hang out with, who are not paid to be there. Now, I'm a paid advocate, but importantly, I'm removed from those situations, so I can support people to just have normal relationships. The ones that I have with my family and my husband, it's That's not a carer role. That's a partner role. And I think it's important for people to have as normal life as possible. My advice would be to think of the things that you've always wanted to do and not be told by your school, by your teachers, by your parents what they want you to do or what they think is the safest model. Because the safety of what others want for you, especially if you've got a disability, is not as fun. You're supposed to move into share houses that are terrible, and you have arguments with people, and everyone's eating beans for a week. You're supposed to have those bad experiences. You're supposed to have crappy jobs that you would never go back to. You're not supposed to be in that for the rest of your life. You're supposed to be able to work in something. What's that saying, that if you work somewhere you love, you'll never work another day in your life. That old thing. And people say, oh, that's not real. It's not available for me. Well, of course it can be, but you've got to be able to dream it, and you've got to be able to find the people who can help you get as close to that as possible. Because of course that's totally doable. You don't have to love the work that you do. What if it's the colleagues? What if it's the people? What if it's the place the building that you turn up to? It doesn't have to be the actual, the hands-on job that you're doing, but that environment where there's something about it that ticks all those boxes for you is really important. When you're only living out the dreams of the school, of the teachers, of the parents, then you're not living your own, and that ain't good enough. So find the people who believe in your crazy dreams, believe in those wild thoughts that you had about yourself, and want to see you actually thrive, not just be safe and have a place to go to 9 to 5, Monday to Friday. Because 9 to 5, Monday to Friday, if anyone just found out from a pandemic and going into an office or a place of work, we all just found out globally that we don't have to do it that way. So if that's the only way that people are behaving now, is that is what equals work, that's what equals value, then they need to have a lesson in what we've all just been through, and remember that we cannot leave people behind just because we opened the door for different ways of working and different ways of being with our friends and family is really important. We othered people before that, and we are othering people now because we've started to move away from the flexibility or the opportunity to do things differently. Everyone during the pandemic, and we are still in a pandemic, everyone understood what it felt like to either be locked down, to be locked in, or to find that your local restaurant or pub or nightclub had closed, and what that felt like. People with disability have been feeling that for years, and no one did anything about it. Now we're feeling it still, because those changes, everyone's just gone back. So those places may still be inaccessible. Those places may still be places where people are locked out of, or not accepted, or feel unwelcome. So we have maintained that othering of our fellow human being, and I think that there were lessons that we could have absolutely taken advantage of through that global environment of dealing with something as devastating as a pandemic. And I think that's something we need to keep reminding ourselves. The change that I'd like to see from having access to a website like this in a digital platform is, one, the privacy, or the ability to just do it by yourself, to not have to bring others in to ask, who should I talk to? Where should I go? What do I need to do? That this is a place where access to individuals who can talk to you about the resources, or access to the resources as this thing evolves, potential for that to be there, and for an individual to be able to look at it without anyone else is really important. And so to get it to a point as it is improved upon, because everything gets to be improved upon, as it gets to be improved upon with the feedback from users as people start to use it, especially people who may have their decision-making capacity reduced. They may have a developmental disability. They may have a brain injury that means that their ways of interacting with information and finding information is different from the general population, that they can use it as easily as possible from their hospital bed, from their group home, from the transport that they're in that's taking them from one service to the next, that they can get on something, look it up, and find a way to get out of whatever it is that's making their life terrible, whatever it is that's putting them in crisis, whatever it is that is compromising their health and well-being, that they have an in to find people who can support those dreams, those wild ideas that they had for a better life, which can be completely in conflict with the people who also love them, who may be family and friends, because we're allowed to think very different things. I think having access to that for people with disability, but with all the disabilities. So it's not the toilets and ramps wheelchair users. It's everyone else as well. Can get in there and find what they need very quickly, or at least get a response from a provider very quickly.